name is Zheng. I am a senior nursing student at the Wellstar School of Nursing in Kennesaw State University. My co-researchers are Flores and Zarate, who are also senior nursing students that are in my graduating class. Our mentoring faculty is Dr. Mary Ramos, who is a professor at our college that teaches and engages in research. So we did our research on barriers to medication adherence in HIV-positive minorities. Some background on the subject is that in the United States, 1.2 million people are living with HIV, and that the minorities make up 74% of that number, which makes up a large majority of this patient population. Minorities are more likely to have complications with medication adherence, and this research aims to identify some of those barriers. So some background on the treatment of HIV is that the medication that is used to treat it are called antiretroviral therapies, or ART drugs for short. They can effectively suppress the virus to the point where patients cannot transmit HIV to others. However, the therapy only works if consistent intake of ART and viral suppression or undetectable status is achieved. If this does not happen and patients are inconsistent with taking their ART, viral resistance often recurs, thus making HIV harder to treat. So some of the barriers we have identified through our literature review were that many HIV-positive minorities were misinformed on the effectiveness of ART drugs and just overall disease course of HIV by either a language barrier or poor explanation. Other barriers identified were poor mental health, difficulty navigating the healthcare system to find effective care, and the cost of ART. So some of the things nurses can do in the outpatient setting is to provide educational resources to these patients in a variety of different languages, or use an interpreter to help with care if there is a language barrier. And they can also inform patients about programs to help with cost of care, such as the Ryan White program, which can essentially either decrease the cost of ART or just cover the cost in general. So in conclusion, further research is needed to gain more insight on these barriers, and studies that particularly look at these barriers needs to be more extensive and needs to be more quantities of them to have a more accurate look at some of these barriers that we identified. If you have any questions about this research project, please leave a comment below and or email us at the emails provided under the reference section. And if you want a full bibliography, you can also email us to get that list to you. Thank you, everybody, and I hope you enjoyed this research.